Hello everyone, Chad Shafer, ShaferPT.com. I want to talk today about the most common movement patterns in relation to TMJ issues. So typically there's two different types of movement patterns if you looked at textbooks and you look at Google. So these two movement patterns are the C curve and the S curve. We're going to talk about the C curve to begin with. So a C curve is usually a little bit easier to treat. Again, not all the times, but we're going to describe it in detail. So I'm going to use my hands as my mandible when I move side to side and I open. So a C curve is when someone opens their mouth and they deviate. We're going to go to the left to begin with. So say I'm opening, as soon as I open, I immediately am going to start going to the left. And how that happens is there's usually no clicking or popping. Sometimes there is, but more commonly there is not. And there's the left side here, which is going this way. The left side isn't moving enough, and what happens is that right side overcompensates and really tries to glide in that direction. So again, that usually means if I'm C-curving going to the left, that usually implicates that left side as being the problematic side as we go over to the left, because again, it's being hypomobile, meaning it's not moving enough. The right side's overcompensating, being hypermobile to compensate to achieve some motion. So in that case, I would address the left side first because I think it's going to be the primary pain generator. But again, just because I think it's going to be the primary pain generator, we have to make sure that the symptoms respond. So what that means is if you open your mouth and you say you have a 5 out of 10 pain and we do something on the left side that I think is going to help you and it doesn't make any difference after retesting your motion, your functional baselines, let's look at the right side. Maybe the right side is implicated and it's going to make your pain go away. So just because you see it doesn't mean that it's implicated, doesn't mean that it has the potential to generate pain. It may, but the best way to tell is if you test it, retest it, and do an intervention. Really, it's test, intervention, retest. So anyways, the next pattern is the S curve. So the S curve is a little bit more involved with the joint itself and with the disc. So let's go over that a little bit. Essentially what happens in an S curve, as soon as you start to open the mouth, you're opening and then going to the right side. We're going to go to the right side this time. And when you go to the right, you get a click or a clunk. Typically it's a click depending on how much of that reduction that you're having with the disc. So we're going to the right, and then we return back to midline. And then when we close our mouth, we go back to the right, click again, and then return back to the middle. Now that click is known as a reduction. So if you think about your shoulder joint, if you dislocated your shoulder and somebody comes and relocates it, relocation is called a reduction. So that's essentially what's happening in the disc-condyle relationship. Is you go to open, click. Typically that's a reduction, so the disc is going on top of the condyle where it's supposed to be, and then it's moving back to the middle. I come back to close, I come back dislocated, and then I come back to the middle. I don't really use the word dislocated because it's a little scary to patients and it's really not beneficial to use that, but I use the word reduction because it sounds a little bit better in relation to when it actually goes back into place. So that's usually where the clicking and clunking come from, and again, those symptoms can be pretty much taken away in a couple of sessions as long as you know specifically what you're dealing with and where the disc is at. Again, the disc is typically more anterior compared to the condyle, not posterior. Posterior discs are a lot less common. I haven't seen one in practice quite yet. But typically it's anterior. You get the clicking with the S curve when you close.